U.S. Health Secretary Robert F. Kennedy Jr. said on Wednesday that the central focus of the National Institutes of Health and the Food and Drug Administration will be studying ultra-processed foods, sugars, and food additives. He said this effort is part of restoring public trust and bringing back strong science-based decisions.
One of the, I think, the really important accomplishments that we've done over the past 100 days is we've been working with the food industry, and we found the food industry very, very receptive. We think we have good science that links almost all of these dyes with ADHD, with neurological injury, with cancer. And they've agreed to phase out the two worst of them, which is orange bee and red citrus number 3, within 2 months, and the other 7 dyes within 2 years. And some of the food companies like Tyson's Food have already eliminated them because of our talks. They asked us to do one thing. They said, can we try to fast track the vegetable dye substitutes that we need? And we have fast-tracked those, and we've already got them approved. So we have 3 dyes approved this week that are substitute dyes that can be used by the food industry. And we're going to continue to respond to the needs of the food industry. We're going to continue to work with them. And I'm happy to work with you, Congressman.
Kennedy added that harmful chemicals stayed in products for years because the government didn't want to challenge powerful industries.
When you envision what we're going to do on nutrition writ large to try to make us a healthier country, what do you think we have to look at? What are the first things we have to look at?
I mean, you know what, and that's a really good question, Congressman. What we need to be doing is NIH has done really good. And I talked to Congresswoman DeLauro last night, and she said, look, NIH has done all this great science so that we can cure cancers faster. And so my question is it a great thing that you can now cure or treat colorectal cancer so only 50% rather than 100% of people die? Or should somebody be thinking about why are we getting colorectal cancer in children, which has never in the history of humanity happened before? It's now an epidemic. There was nobody at NIH to answer those questions. Nobody. No research was done on it. The etiology of all these chronic diseases were just buried because they didn't want to offend the large industries who are putting these poisons in our food and putting them in our pharmaceutical products. For some of these ingredients, we just need to let the public know and probably do labeling so that people can make their own choice. If you want to eat a Twinkie, if you want to drink a Coca-Cola, you should be able to do that. We're a free country. You ought to know that it may increase your cancer risk and that it may increase your risk for diabetes. And so we're going to study each of these ingredients, starting with the most common ones, the greatest, the suspected culprits. And we're going to tell them ones that are so bad they should be taken away. We're going to work with the industry to get rid of them.
Great idea. And
the other ones we're just going to tell people so they can make an informed choice.
Kennedy said the response should not stop with just medicine, but instead focus on finding what's causing these health problems.
We're seeing epidemics of colorectal cancer, young age Alzheimer's, all these things, and I think the research at the front end is every bit as important at the hind end.
And Senator Murphy made a good point. The NIH has made all these extraordinary breakthroughs, and particularly in treating cancer and reducing mortalities for colorectal cancer. But my question is, isn't it as important to find out why kids are getting colorectal cancer? When you and I were kids, there were 0 kids with colorectal cancer. It's an epidemic now. So it's not really a badge for us when we say, oh, we can make it less lethal. Why don't we go figure out what's causing it and eliminate that exposure? With all of these, with Alzheimer's, with heart disease, there's something is making Americans very, very sick. And our response should not be just, okay, we'll develop a pharmaceutical fix for it or a medical fix. Let's figure out what it is and get rid of it so we can have healthy kids again.
Supporters of Kennedy said that he has delivered early on. his Make America Healthy Again, or MAHA, agenda. He's pushed companies to drop artificial dyes, promise to study autism, and reverse fluoride recommendations. Several Republican governors are now backing soda bans from food stamp programs. Kennedy also defended the White House budget request for his agency at a House Appropriations hearing. It includes a $500 million boost for his MAHA initiative, which promotes nutrition and healthier lifestyles. Some lawmakers, like Representative Chuck Fleischmann, raised concerns about how these changes could affect businesses in their districts. In a strong statement, Secretary Kennedy said the Biden administration and the federal government enabled widespread child abuse.
Are probably much higher than that. They could go up to 500,000. And if you look at the grand jury report from Florida, what happened to many of those children is just horrific. They were being. My predecessor was deliberately employing a policy of speed over safety. So they waived all of the identification requirements for sponsors. Sponsors were not required to show valid identification. They were never fingerprinted, so we didn't know if they had criminal records. There was no DNA testing, so their claims that they were taking a family member were
dubious at best.
Yeah, they were dubious. And we in Cleveland, one of the according to the grand jury testimony and the grand jury findings in Florida, there are so many episodes. One of them is a man in Cleveland who picked up a 16-year-old girl claiming to be her brother, raped her, impregnated her, put her in a home where she was being regularly raped of all men, and then got a 16-year-old boy who disappeared and went back 2 other times for other children. This was happening again and again. One agency placed 592 children with 120 sponsors.
Secretary Kennedy said that the new budget prioritizes public health and safety, focusing on restoring trust in areas like food safety and child protection.